Mr. Chairman, first let me thank all the members for their comments and their suggestions. With the permission, may I display a few slides. Today, Singaporeans are living longer, and our health-adjusted life expectancy, which estimates the number of years a person is expected to live in good health, remains one of the highest in the world at 72 years for males and 75 for females. Women always beat men in this. But we cannot afford to be complacent. Our population is aging rapidly with a growing chronic disease burden. About 3 in 4 Singapore residents aged 65 and above are affected by diabetes, high cholesterol, or hypertension, or a combination of the three. If nothing is done, diabetes, for example, is projected to affect more than 1 million Singaporeans by 2050. We want to not just live long, but also live well. To do that, each of us must also do our best to adopt a healthy lifestyle. We also need a good healthcare system that is both accessible and affordable. Dr. Chia Shi Lu asked about our progress on Healthcare 2020, which outlined our strategy to improve accessibility, quality, and affordability of healthcare. We have made good progress, but much still needs to be done from now until 2020 and beyond. Over the next few years, we will continue to add healthcare facilities across Singapore. To the north, we are developing Woodlands Health Campus, which will be ready progressively from 2022. Down south, we are developing Outram Community Hospital and the new National Cancer Centre as part of the redevelopment of the Outram campus. In the northeast, we are on track to open Sengkang Hospital later this year. The new Changi General Hospital Medical Centre in the east will also be ready this year. In the west, we look forward to the new Centre for Oral Health at the NUH, not forgetting the central region, where the Integrated Care Hub and the National Centre for Infectious Diseases are being built at Novena. Since 2011, we have added 1,700 acute hospital beds, 1,200 community hospital beds, and 5,300 nursing home beds. To support aging in the community, we have also added 4,200 home-based and 2,900 center-based places. We have also grown our healthcare workforce by 25,000, or about 36%, since 2011. To ensure healthcare remains affordable to Singaporeans, we increase subsidies at outpatient clinics and enhance Community Health Assist Scheme, or CHAS, for primary care, commonly known as the Blue Card and the Orange Card. In 2015, we introduced MediShield Life for inpatient care. We are also investing in a future-ready workforce that will anchor the transformation of our healthcare system. SMS ME Corps will elaborate on our plans to grow and upskill our healthcare manpower later. We need to innovate and find new ways to deliver quality care to patients in a more effective and efficient way and for better outcomes. For example, at Pioneer Polyclinic, which opened in July 2017, patients are cared for by a team comprising doctors, nurses, and allied health professionals. Having a regular primary care team will ensure better continuity of care for patients. This is one of the many initiatives that has improved the quality of care. Sir, our continued investment in healthcare means higher national health expenditure, or NHE. NHE has increased by more than 60% in 5 years, from 10.9 billion in 2010 to 18.9 billion in 2015. At 4.6% of GDP, this is lower than most developed countries, but we expect this to rise over time as our population ages. On the other hand, government expenditure on health grew twice as fast, by about 120% over the same period, to fund infrastructure investments and to keep healthcare affordable for Singaporeans by reducing their share of out-of-pocket expenses from about 40% to 30%. With the introduction of the Pioneer Generation Package and MediShield Life and the extended use of MediSave, the out-of-pocket expenses for 8 in 10 subsidized hospitalization bills was below $100. But we cannot simply keep increasing subsidy or insurance payouts. Higher insurance payouts will result in higher premiums, while higher subsidies will need to be funded. All these will be borne by Singaporeans eventually, through higher premiums and higher taxes. Therefore, we need to take a long-term view on this. Even as we implement Healthcare 2020, we need to look beyond 2020 and make three key shifts to ensure our healthcare system is future-ready. The three beyonds, which Dr. Chia outlined or reminded us, provided the roadmap to a sustainable system beyond Healthcare 2020. First, we are going beyond hospital to community. Over the last decade, we have increased our total spending in primary care and intermediate and long-term care sectors by close to 4 times, from 1.3 billion in FY 2007 to 11 to $5.1 billion in FY 2012 to 16. These investments reflect our priority to anchor care firmly in the community. As we continue to invest in community care, we also need to bring social and healthcare services closer to better serve our people. This has led to the formation of the Silver Generation Office, as well as the expansion of community network for seniors, which I elaborated earlier in my speech on SG Cares. Senior Minister of State Lam Pin Min will share later how we are strengthening primary care for the future. 6 new polyclinics are being built under Healthcare 2020, 2 are already open, and 4 more to come by 2020. And we will add another 6 to 8 new polyclinics by 2030. This is part of a commitment to ensure Singaporeans can access primary care closer to their homes. And we are not just building polyclinics, we are also partnering private GPs through the primary care networks to offer subsidized team-based care in the community under CHAS. Our second shift, beyond quality to value, plays a pivotal role in ensuring sustainability. We adopt a multi-pronged approach to manage healthcare costs. We set up the Fee Benchmark Committee earlier this year to provide a reference to guide doctors in setting reasonable fees and to help patients make informed choices on their care options. We established the Agency for Care Effectiveness, or ACE, to provide guidance on cost-effective drugs and treatment. And I thank Dr. Chia for supporting the work of ACE. We also introduced the Healthcare Productivity Fund to spur productivity improvement efforts in our healthcare institutions. But we need to do more. Mr. Chairman, co-payment has been an integral feature throughout all our healthcare schemes, including MediShield Life, as well as integrated shield plans. It plays an important role in ensuring our healthcare system is sustainable by emphasizing personal responsibility in healthcare, by encouraging service providers to focus on appropriate and cost-effective interventions, and by nudging patients to make prudent decisions in healthcare services. This is important as it ensures that all stakeholders, including patients, have a stake in the decision. As Dr. Chia pointed out, some private insurance policies offer zero co-payment coverage. They are called full riders. Such riders encourage a buffet syndrome, as patients do not need to pay anything when they receive medical treatment. It undermines the co-payment principle and dilutes the personal responsibility to choose appropriate and necessary care. This will encourage unnecessary treatment, leading to rising healthcare costs, not only for those with such riders, but for all of us. For all of us. Therefore, the Ministry of Health has been working with the insurance industry, and we have issued a set of new requirements to integrated shield plan insurers, which will be applied to all new rider policies. We will require them to have co-payment features going forward. Senior Minister of State Chee Yong Tat will elaborate more. This will encourage responsible behavior by both patients and healthcare providers. We will continue to review our healthcare financing policies to ensure that co-payment remains affordable through targeted subsidies, Medisave use, and for those who still have difficulties, Medifund will be the safety net. No one will be denied appropriate health care because they cannot afford to pay. But ultimately, the best way to beat rising healthcare costs is to stay healthy. This is the focus of our final shift beyond healthcare to health. Parliamentary Secretary Mr. Amin will give an update on the war on diabetes and detail how we are encouraging and supporting healthier lifestyles. We will create a supportive environment for Singaporeans to lead healthy lives, but each of us must do our part. These three shifts will be a multi-year effort to support these initiatives. We have taken the first step to reorganize ourselves. Last year, I announced plans to reorganize the public healthcare system into 3 integrated clusters. I'm pleased to report that the reclustering exercise has been successfully completed. I would like to take this opportunity to thank the unions and the management for their support in this exercise, and all our staff who have worked very hard to ensure a smooth transition. That's the good news. But the bad news is, this is not the end. In fact, it is just the beginning of a long journey to create synergy and deliver better care for Singaporeans. Let me share an example. A patient, Mr. H, 73 years old, was admitted to Singapore General Hospital after a fall last year. Besides rehabilitation treatment for his fall, he also needed to manage his diabetes and hypertension. Ms. Siti Haja, a patient navigator, an experienced nurse from SGH, coordinated both his health and social care even after he has been discharged. Ms. Siti visited him fortnightly and ensured that his chronic conditions are well managed from home. As he lives alone in his flat in Kaki Bukit, the Changi General Hospital Community Care Team, now part of the SingHealth team, was activated to accompany him for follow-up at Bedok Polyclinic and arrange for home help services for him. I am pleased to know that Mr. H's condition has now stabilized, and SingHealth team continues to provide him with strong support. This is what reclustering is all about, bringing healthcare institutions and the community closer together to provide good, seamless care for patients such as Mr. H and many others. Another example of this synergy is the new National Integrated Supply Chain we are setting up. This goes beyond the group procurement office currently run by SingHealth. It pools the whole supply chain's functions, including procurement, as well as resources of the 3 clusters together to achieve economies of scale, create greater synergy, develop new capabilities, and evolve innovative supply chain solutions. This will yield system-level gains for patients, providers, and staff. This will also help to mitigate cost increases and bring greater convenience to patients. The transformation process must continue. Advances in medical science, increasing digitalization, and connectivity hold tremendous promises for rethinking healthcare. In addition to progressive improvements, we also need to explore game-changing ideas. That is why we have set up the Ministry of Health Office of Healthcare Transformation, or MOHT, to identify and experiment with bold innovations. MOHT will focus on long-term ideas that can be scaled up for system-level transformation. Some of these ideas will be tested at the Health Empowering Alexandra Hospital campus, which NUHS will take over from the second half of 2018. Similarly, we'll be initiating the master planning of NUH's Kent campus in the West to see how Kent can be best positioned to meet future healthcare needs. We have already started some development at Kent campus. In 2013, we opened the NUH Medical Center, and we will be opening the National University Center for Oral Health next year. The master planning study presents us with the opportunity to plan ahead and reimagine how the future Kent campus, including the main NUH hospital building, which is more than 30 years old, can be rejuvenated to support current and future models of care. At the end of the day, We must remember that the state of our health primarily depends on our choices. As far as we can, we must choose to live healthily. This is the key not just to a sustainable healthcare system, but a vibrant society and good quality of life. Mr. Muhammad Irfan is a good example. He is pursuing a sports diploma at Republic Polytechnic. Keeping fit is as much part of his work as it is his passion. Not only is he enjoying the benefits of better health, he's also going the extra mile to influence others. He persuaded his family to start eating brown rice and more fruits and more vegetables and less fried food. Last year, he co-started a health program where he was the health coach. And every week, the group gathers to exercise. Mr. Irfan believes an active community can motivate individuals to sustain a healthy lifestyle. He exemplifies how taking ownership of one's health can have a ripple effect to better the lives of many more. Mr. Chairman, I believe that by working together, each of us doing our part, we can bring about better health, better care, and better life for all Singaporeans. Thank you.